Hello, everybody. We're going to get started here just in a moment. Letting you all kind of just log in here in a second, but we'll go ahead and get started as you guys are all logging in. But thanks for joining today for our insightful panel discussion. And we're going to be really focused today on the discussion of centered around athlete-centered care and focusing on the crucial relationship between strength conditioning coaches and sports medicine staff. Our esteemed panelists will be going through and introducing themselves, but including professionals both from the strength conditioning side and athletic training side. And we're going to be engaging in conversations to explore strategies to build trust and collaboration between both. Ultimate goal is to provide the best possible care and support of athletes, and shed some light on the importance of placing athletes at the center of the care process and enhancing the cooperation between our key stakeholders here. So I'll start off. My name is Francis Neric. I'm the USREPS president currently. And in my day job, I'm the associate vice president of credentialing and certification at the American College of Sports Medicine. And I'll hand it over to Brent.
So I'm Brent Feland. I am also a treasurer with the USREPS, but in my full-time job, I am an exercise science professor at Brigham Young University, also teaching within a sports medicine program or an athletic training program where we have a master's of athletic training within our department here, as well as other hats in some help with the Collegiate Strength and Conditioning Coaches Association. So
wonderful. Sandy?
Hi, I'm Sandy Abney. I'm the Chief Science Officer for the Collegiate Strength and Conditioning Coaches Association.
Don?
Hi, I'm Don Decker. I'm the CEO of the CSCCA, and prior to that, spent 32 years as a college strength coach.
Wonderful. Tim?
Yeah, thanks, Francis. Tim Weiesner here. I'm representing the Intercollegiate Council of Sports Medicine from the National Athletic Trainers Association. So I'm an athletic trainer, associate athletic trainer at Iowa State University, working daily with the wrestling team here and also teaching in our Masters of Athletic Training program each year as well.
Awesome. So let's just hit the ground running on this. I think we had a preliminary discussion earlier. We kind of did some early discussion, and so I'm super excited to kind of walk through the questions that we have for you all. So the very first one, I think, is really understanding what an athlete-centered care model is and the related staff. And one of the questions that we have is, what are the key components or elements of an athlete-centered care model, and how do they contribute to the athlete development and performance? And so I want to ask that to Tim. When we were talking about the athlete-centered care model, how do you guys develop the culture of between the athlete-centered care model, and kind of what your thoughts are there?
Sure, yeah. There's really a lot to that, and a couple big things that really come to mind for me are really being consistent and available to our student athletes and showing them that you really have their best interest in mind. And when you think about this from the medical standpoint, it's really important to put their well-being first and foremost in every decision that I make. And so it's a really ethical dilemma on a daily basis to work through all those things, because they see situational distress in the team. Maybe there's a couple losses, maybe there's various injured athletes on a team, and that can easily lead to making other decisions to rush someone back to the field or something. And so if you're really consistent in your decision making, you're available to discuss those decisions with your student athletes, that really kind of lays the basis for that. And then they understand and they believe, and that's how I think over time you can build that culture, by being really consistent in your decision making. So the athlete knows what they're going to get from you every day. I think one of the biggest things that I try to do on a daily basis is, I have a group of guys coming in here in about an hour and a half for afternoon workout, and they know exactly what they're going to get from me every day. And there's really no confusion on what the expectations are from me in their rehab, in their treatment, and also the decisions I'm going to make for them. The communication with the coaches, the communication with the strength coaches is really going to be consistent. And they know that if they have a concern, if they have an injury that I'm working through, I'm going to communicate that properly to the strength coaches. So when they go to work out this afternoon, the coach is going to be fully aware of exactly what the limitations are, what the restrictions are, and it gives that athlete confidence that I care about their injury, that I care about them personally, and that I'm able to take care of them properly and not, again, rush them back or have other factors that could be affecting my medical decision making. And so really putting that athlete's best interest to the center of your decisions is really how I think about that.
So do you guys at your organization, do you have joint like in-service trainings between the strength conditioning staff and then athletic training staff? Is that what you do, or is it kind of separate and then you have this, or is it kind of like separate training and then you have one-off conversations? How does that work?
Sure, yeah. You know, we do come together. We've recently just kind of started doing some of those things, and where we're bringing everybody, whether it's sports medicine, medical, nutrition, mental health, and strength coaches all together for a collaborative meeting. And really, we just had one recently, and it was led by senior administration of the department. And so everybody, we're talking over 50 people that are front facing to the student athlete at our university, know that that's led by administration. It's supported by administration. It's an initiative of the athletic director that we do this. And so kind of these cross-disciplinary meetings are really important. So everyone understands what my goals are. I understand what the strength coach's goals are. I understand that they're all working in the best interest of the student athlete. And so kind of these cross-departmental meetings can really be really advantageous and maybe a jumping off point for smaller sidebar discussions to talk about internally in your team. But these global department-wide meetings really help everyone understand what the goals of the overall department are, and then the specific missions of each unit inside that department.
Awesome. So I'm going to ask this kind of a similar question to Dawn and Sandy, and kind of with your background as strength coaches. But when you're thinking about trust and successful implementation of an athlete-centered care model with multidisciplinary staff, how do you build that trust? I think one of them is, I guess, when you're reflecting on what you do now or what you've done as a strength coach, how did you build that sense of trust with the sports medicine staff? And I'll go with Sandy first and then Dawn, if you're okay with that.
Yeah, sure. For me, in my experience and having a background in medical fitness, I had the ability to have a common language with the athletic trainer, which I really felt like helped maybe catapult the trust and the building of the friendship. So that was what I found to be really helpful. In environments where I feel like the high performance model really thrives is where you have communication, you have trust, and in that environment, collaboration can be allowed to flourish. And when you're in environments in that nature, as you start to see results from that, right, with everybody working together, I think that just adds and builds to the gaining of more trust.
Dawn?
I agree. We've heard Tim and Sandy talk about, communication and collaboration, and talking to those who run this model currently. They also talked about the respect factor and leadership, and that's what you're getting to, Francis, in terms of department heads and administrators taking the lead to really bring this front and center. And what I found is competency is a huge aspect of developing trust. Consistency is a huge aspect. Integrity, care, and the old saying is they don't care how much you know until they know how much you care. And so establishing that competency first within the departments, and meeting with the athletic trainer and showing them what you do from a flexibility standpoint, a mobility standpoint, what your prehab protocols are, how you teach exercises, how you're going to roll out conditioning and what that's going to look like in your progressions, so that they trust what you're doing and they trust the level of competency that you're bringing to the table, that they see the care that you're going to take care of the athlete. They know the integrity that you're going to stand for in those moments. And I just think that's huge as you establish that trust, because trust is something you earn, not something you ask for.
Absolutely. I want to pause just for a moment here. For all the attendees, If you have any questions, please add that to the question and answer button on the bottom. I'd love to be able to hear at the last 15 minutes, we're going to be able to answer those directly. And this is really your chance to ask our subject matter experts directly. Any questions that you may have, any burning questions you have, it's your opportunity to really kind of ask those to our folks here on the panel. I do want to kind of ask similar question to Brent about that kind of relationship that you see with a patient-centered care model between physicians and physical therapy, et cetera, and building that trust between the team members. What are your thoughts on the relationship building and communications and how important that is, especially when you're working with different job roles?
So, yeah, I mean, two very different job roles. As a physical therapist working actually out in the medical community, it's very different. Your communication is predominantly between, patient and medical doctor. All those come through referral that way. And there is in order to be able to establish a really good relationship, you have to be very communicative in talking to the doc about the progress. Sometimes you'll even find, what the doc sent them over for, you'll actually find in a deeper assessment, because really patients don't get a lot of time with docs. You'll find that there's something else that's wrong, and you go back to the doc and let them know what that is. But your ability to constantly get referrals from the docs is all based off communication, and it's a personality match. And the same thing happens, right here at the university between athletic trainers and the sport strength and conditioning coaches. A lot of it is really strongly how good that communication happens is very personality based. I see the willingness to work with each other being the biggest factor between the two. That if egos get in the way, and some other really interesting things that happen in athletic trainers, they get stressed. Strength and conditioning coaches, they get stressed. We have an athlete that we're trying to care for. There's a whole bunch of other pressures on that athlete, and some other pressures that come externally from coaching staff. But the relationship between the strength and conditioning coach and the athletic trainer, sometimes some of those stressors are things that we don't think about, such as pay scales, number of hours, what kind of pressures strength and conditioning coaches is getting from coaching. In the collegiate athlete care model, it is so much more complicated than our normal medical outside in the physical therapy clinic model. And there's a lot of things to consider there.
Absolutely. And so I kind of want to go around the horn a little bit. If you can provide an example, an effective athlete-centered care model, when you think back, man, that was a really great experience that of the cross collaboration between professionals. Can you give me an example of one? And so let me start with Dawn first. If you can think of one which is man, gosh, these are the qualities, or this is kind of like an example of what I went through as a strength coach, that this has been really awesome. It was an awesome experience. And I want to kind of start with you, Dawn, if you had any thoughts.
Yeah, the last place I coached was New Mexico State University, and I just had a great experience there with the athletic trainer. We would meet every other month, and we'd meet in the weight room, we'd meet in the training room, and we'd discuss philosophies as a staff, and we would do demonstrations on, how we taught things, and went through our exercise progressions, our prehab protocols. Obviously there was great collaboration and dialogue in that moment, but letting them see exactly how we were teaching things and how we were structuring things and the care that was going into that. And then reciprocating that and going to the training room and then getting into their philosophies and their prehab protocols and their rehab protocols and progressions, and teaching us what that looked like and how they were doing that. Just the trust, not just between the two department heads, but through the entire staffs, because there was a lot of spillover, obviously, with my staff coaching other sports, the athletic trainers, being responsible for other sports, and having those dialogues went a long way to establishing that trust, belief in one another, being able to allow our department or their department to handle things, and they could trust that. That was big.
What are your thoughts, Tim?
Well, I'll tell you what, Don, you may not even know it, but that relationship was so good that from the medical side, that allows me as the medical provider to maybe reduce some restrictions on my student athlete, because I understand where you're coming from. I understand your philosophies and your integrity in the weight room and in those conditioning sessions that allow me to loosen the reins on a long-term rehab case, because I know that where you're at, where you're coming from. And so that relationship is fantastic. And so it's great to hear when we have those. And, just thinking about that currently, and admittedly, I'm not a normal collegiate athletic trainer. I have one team with 50 athletes. I'm very lucky in my environment, in my job, and that's not normal. So I have 50 athletes, a couple coaches, and one strength coach that I deal with. And he has primarily our wrestling team, but also does a few other things too. So our ability to collaborate and talk is daily. And so whether it's long-term rehab cases about what I saw in rehab this morning and how that's going to translate to what he's going to do with these athletes in the weight room this afternoon, is really, really good. And so I understand that. I take it for granted, I'm sure, but I understand that that's lucky and that's not normal. But then during practice this afternoon, we're going to be able to stay together and talk about what we're seeing with the guys. And so to me, that is really what we're thinking about when we look at patient-centered care, is that daily communication that I'm able to have and he's willing to have and enjoys and relishes. And that's been really fun to do with him the last couple of years.
Awesome. Sandy?
So I've been a strength and conditioning coach for 23 years, and, seeing the evolution of this, we first started off being very siloed and not having any communication whatsoever, which nowadays seems reckless, really. And the evolution to the high performance model, where my last place of employment, we worked in such a phenomenal, true team setting. There was high collaboration across all departments. And really echoing Don's experience and what Tim just said. I mean, when I would start to plan out my training plans, my athletic trainer was right there with me, because we were looking at how are there ways that we can not only address global issues, if we're plugging stuff in to warm up and cool down just to get those added benefits that can make our athletes more injury resilient, all the way down to individual things, individual needs that we could do to help the student athlete in the weight room to potentially alleviate more time from them having to go into the training room. So it was a true team approach. I leaned heavily on my athletic trainer and vice versa. And it was a pleasure working in that environment. And in addition, with seeing nutritionists come on board, the nutritionist was put into the mix as well. And we looked and we collaborated on schedules and timing and how could we, in the perfect world, how could we put all of that together to optimize the athlete's environment?
That's a great point. I want to dovetail off that just a little bit. So Sandy, when we think about like the high performance team or athlete-centered care model, like what are we talking about in terms of the professionals that are involved? Clearly, we talked about athletic trainers and we talked about strength conditioning coaches and the sport coaches. Who else is involved in that type of that care model?
I think it depends on what level division you're at and the budget that they have, but sports psychologists are now coming into the mix. Obviously, your medical staff, your medical doctors are in that mix. Even student advisory services can be in that mix as well. I think it really is dependent upon the level of division that you're at and how many professionals have a seat at the table in the high performance model.
Awesome. So I guess it's like, as a coach, as coaches that are here and kind of and sports medicine professionals that are here on the call, we're always looking at opportunities to improve. And so it's just like I think when you're thinking back into your kind of professional roles and kind of your experiences, can you provide an example of a model in which could be improved? And we're always like looking at like, the relationships and communications, things like that. Can you provide an example of where you go, what, you saw it and you're like, oh, gosh, I wish this other stuff could have happened and we could have made this a better relationship. Can you give an example of that? I would say that more generally versus like calling out any particular institution. So if you can do that, let's go with Tim first.
Yeah, just one thing I was thinking, and Sandy kind of used the word siloed, and that's what I was thinking here of. I've seen a couple of situations where there's some siloed care between the two departments of strength conditioning and medical. And so if I'm completing, or the athletic trainer's completing a rehab and feel like they're ready to go back, but the communication is not there, or the trust isn't there between the departments, maybe that strength coach is going to bring them along more slowly. When this athlete really has capacity and ability for more, they're not really ready to turn them loose in activity or in conditioning sessions because that communication hasn't happened. And so maybe they're overlapping some of the rehab that I've already done, and I've tested them out and I feel really good where they're at. But maybe Sandy doesn't know that, so she's not really feeling great about cutting them loose in long runs or full field activities or things like that. And so that's a situation that I've seen in the past where it's almost like you see some strength coaches redoing some rehab out on the field that we just did the morning before in the athletic training room. And so that's where there's certainly this collaboration between departments. And as I talked about that kind of global meeting, that's where you end up with some presentations between professionals, whether it's mental health, nutrition, strength and conditioning, or whatever. And so everyone understands where you're coming from. And again, their understanding of your abilities and your goals can really change things there.
Awesome. Sandy, what are your thoughts there?
Well, I really want to echo what Tim said. When you asked the question, my first thought was silos, and working years ago in the profession, that's how we operated, unfortunately. I think to some extent, we didn't know what we didn't know. And I really feel like the evolution of technology and the influence of technology within athletic performance has helped to be a catalyst to bring people together and knock down some of those silos to be able to work together. But yeah, I think that's one of the biggest negatives is when you have departments that are still working in silos. And in today's time, we need to be more evolved in how we're training our athletes.
Awesome. I think we're on pivot gears just a little bit. And I think especially when we have rising professionals or in the industry, I think one of the things that I've heard from employers is that two things from employers. One of them is just like, when we hire professionals, and this is on the medical space, strength conditioning space, and also kind of the health fitness space, is just like being able to communicate effectively is super important. And a lot of rising professionals have difficulty doing that. And so I think, what is your advice on kind of some strategies for rising professionals to establish credibility and trust within that type of high performance model? Like, what are your thoughts?
So, we've mentioned that, competency is an element of trust, right? And so the less a young coach can handle on their own, the less trust from everybody. So, gathering as much knowledge, obviously foundationally, as much experience as possible, even some specialized certifications can be really, really helpful. But, as they're establishing themselves as a coach, one of the things I think is really, really important is being willing to ask questions to allow other people to help speed up the learning curve. What are you doing and what have you found? And I remember as a young coach asking one of my mentors some questions. And after they got done explaining, I asked them how long it took them in their career to learn what they just taught me. And I remember them saying, well, I think I was about 10 years into the career before I really understood this and valued this. And I'm thinking to myself, I'm 2 years into this. I mean, he just sped up my learning curve like 8 years, and so not allowing pride to get in your way and being really willing to allow others to invest in you as you're on your journey.
Sandy and Tim, I'd love to be able to hear your thoughts on that, and same with Brent. And what's your advice to rising professionals in building that sense of trust?
I'll go.
Yep, sure.
Sure.
I would recommend to young strength coaches that they get out of the weight room and out of their offices and walk the halls. Go to the other departments. Go meet with your athletic trainer. Go meet with, if you have a nutritionist, go meet with your sport coach. Develop those relationships. We've talked a lot today about trust, and that's one of the best ways, is just working on developing those relationships. The better you know the people that you're working with, the easier it is to work with them and the easier it is to foster a collaborative environment.
Awesome. Brent?
That is some of the best advice right there. I mean, coming, I don't know what it is about athletics, but athletics brings in a certain level of ego and attitude, both from, we can see it from athletic training side as well as the strength and conditioning side. And there's this kind of, I want to establish my dominance and my superiority here. And that attitude right there is what is just, I would say, desperately needed across the board. There's always individuals who are kind of like that. We can always select, just like we can with any student, that one really amazing student that does everything right. Getting out and actually talking from a physical therapy and an athletic training standpoint of going, here's my realm, here's what it is. Only getting together and really going into each other's spaces and getting to know each other and talking through even some of the unique issues that show up in some of the athletes. You know, there's some unique conditions that need different care and may need adaptations, both to rehab as well as to the strength and conditioning side. And if they're willing to talk to each other and see each other, they start getting a respect for what each other does. And, you know, I'm not going to call out medical models in a sense, but you can really see a difference sometimes between MD medical doctors and DO medical doctors for that reason. There is, in DO programs, there's a huge aspect to that of learning to actually know and truly understand what a lot of other health practices do, because the idea is you got to go out and work with them a lot more, where, you know, MD programs tend to be, we're the ones making the decision, and it's very much a top-down approach. And so in my experience in both medical field and here, huge differences in that, all because of just some background in learning that if you understand each other's sides, you get much better relationships.
Tim, is there anything you want to add to that?
Yeah, just two things for me. When I think about it from our athletic training student education standpoint, our master's students, we push them and the expectations that they have as many patient interactions as they can. And so I think that experience and that hands-on experience with our student athletes, and, you know, me being a preceptor with them so they can see the situation and the interaction that I have with coaches, with physicians, with strength coaches, it gives them maybe confidence moving forward as they start to graduate, but they need to have as many interactions as they can so they have a little more background. I think one of the biggest issues for all young athletic trainers when they're first coming out is just straight up confidence, because they haven't seen enough cases. There's so many possible things that can walk in the door. You know, like I said, I have my team coming in here in an hour, and there could be any number of things that come in the door from our workout yesterday that I haven't seen yet. And you have to be prepared for all those. And it's really challenging for young professionals to do that. And so getting them as much experience as possible is really key. And what I really also emphasize to our students as they're leaving is, when you're young professionals, so say I'm a couple years out and Don is my strength coach and he's been working a long time, there's a lot of information I can get from him. He's not an athletic trainer, but he's worked with a lot of athletic trainers. He's seen a lot of cases. He's seen people come back from injuries that you're going to be rehabbing. And so use his information. You know, we think that the rehab must be 100% initiated through me. And that's not always the case, where my current coaches have worked a long time. There's some help I can be getting from them. So taking information from the smartest people around you and being willing to take that input, I think can really be a big thing. So getting those soft skills for our students to be able to communicate with a wide variety of people and take the input that can help them, and that can really make a big difference for them.
Awesome. I'm going to pivot gears just a little bit here. And really kind of this is a question to Sandy and Don, what your thoughts are here. When we're thinking about the NCCA staffing requirements, and so there's a number of kind of recommendations that came down from that interdisciplinary recommendations. When we think about the role of exercise science programs that are preparing students for the strength and conditioning profession, what is the CSCCA's thoughts on in programmatic accreditation and in helping those students adequately prepare for the job to be a strength conditioning professional, to be safe and both safe and effective, and what your thoughts are there from CSCCA's perspective? And I'll leave it to either of you who'd like to answer that.
All right, well, I'll start and then I'll hand it off to Sandy. So I think, one of the things that Tim just dovetailing off of what he just talked about in terms of experience, and so I think that that's, critical in developing that competency. And, one of the things that we're really, really proud of with our certification is that there's a practicum portion to the development. We feel like that really, really goes a long way in preparing them to move forward in their career. And obviously now with this collaborative and communication that's happening, encouraging those that are going through that program to make sure that they're reaching out and exposing themselves to as much information, as much knowledge as they possibly can to prepare them so they can be ready to go and be one that's trusted when they get into that position.
Sandy, what are your thoughts?
Well, we like to also see, programs that are affiliated with the COAAS, so accredited programs, which we know that the students are going through a similar foundational knowledge and skill training to adequately prepare them for the workforce. And just as Don said, it's the practical application, it's those skills that really need to be looked at and reviewed. And I know that COAAS has done a great job of adding in the strength and conditioning coach component with their knowledge and skill sets to help improve that. So that is something I would highly recommend as well.
Yeah, so for the attendees, this COAAS or Committee on Accreditation for Exercise Science, that's a programmatic accreditation program. And ultimately, it's just like, how do you know as a exercise science department that the faculty are preparing the students to do the job? And there are a number of job roles, but in this particular instance, it's strength and conditioning. So what are you learning in the classroom? What are the practical experiences you're getting? And what are those experiences that you're getting in when we're talking about that interdisciplinary care model, just to be able to see like this is in action. So by the time they graduate, they're adequately prepared to do the job. And so they can take the CSCCA certification. And so that's an independent of any organization or that they went to school for, but they would have a common way of preparing as a strength conditioning coach. And that's really similar to kind of the way athletic training and physical therapy work. And again, that's another way potentially of building that sense of trust, is like we prepared the same way, we've had experiences together and learning together. And so by the time they're ready to hit the job, they can see that in action. So I thought that was thanks for bringing that up. I wanted to pivot into some real talk here. In how do you see the high performance model being similar or different between D1, D2, and D3 programs? Because that really comes down to budgeting, and do you have enough money and resources to do that, and do you have enough staff to do that? So I want to lead with Sandy first on that one, and kind of what your thoughts are, understanding kind of like the way kind of athletic trainer space is going with kind of high turnover, things like that, where you wanted to go, and I'd love to hear follow up from Tim.
Yeah, no, exactly. I think it does boil down exactly to budget, and how many positions can be funded and what those positions can be funded at. In talking to some colleagues in the strength and conditioning profession that are at some smaller division universities, a real challenge that they're seeing is that high turnover rate in the athletic training profession. You know, there's more options for athletic trainers now. And with that comes, with high turnover, comes a delay in building trust. You know, you're always trying to adapt and learn a new person and get to know them. And so that's been a challenge. There's been a higher turnover, and that's been problematic for the strength and conditioning coaches. And ultimately that comes out on the athlete, right? Is if you've always got kind of a revolving door, is how are you building those relationships? How are you getting cohesion for everyone to work together in a simultaneous manner?
Awesome. What are your thoughts, Tim?
Yeah, no, that's a really challenging thing. You know, we've seen, quite honestly, I think this is a critical time for all of athletics, regardless of division. You know, I think some NCAA numbers are that turnover across of all of athletics, not just medicals, nearly 40-45% per year. And so it's ridiculous numbers right now that, you know, we took some time. We had a meeting in Indianapolis and met with the Board of Governors to give them some information at NCAA to tell them kind of what's happening. It's not, some people think it's a shortage of athletic trainers, but it's really a shortage of people that don't want to work some of these tough jobs. And so there is, like Sandy said, more opportunities, which that turnover is really challenging in some schools where now the communication has to be really on point. If you're really only able to see face to face every couple of weeks, it makes it really challenging. And so I think that it's tough. You know, you have one or two strength coaches at some bigger Division II schools, and you know, some of these Division III schools maybe have one, right? And so it's really challenging, where a lot of people are wearing a lot of hats and trying to communicate with all the right people at the right time. But you know, there's things that are going to fall through the cracks, and there's kids and there's situations that are going to not be addressed the best way that maybe they could.
So Dawn, I think maybe like thinking about like what you know now, if you were starting out in, say, a D3 program that had limited budget and limited staff, how would you go about how would you go about it as a strength coach, or as a rising professional? How would I approach that? Because like, look, we don't have the capacity, or we don't have the size of these larger programs. What would you do? Like, how would you start?
You know, knowing that in the athlete-centered care model, that, you know, the focus of that, the establishment of that is that what stands at the center is the athlete with their goals and dreams. And whether you have limited resources or limited personnel, you know, that doesn't change, right? So that's the driving factor for all of us, is helping that athlete achieve their goals and dreams. And so, you know, obviously, if I can look back and know what I know now, it's, you know, continuing to establish those relationships where I can, so that there's can be that crossover, and knowing that, you know, for instance, sports medicine and sports performance, if those are the only two aspects of the model that are present, then we're going to have to wear a lot of hats and reach out and be creative, get the university involved, reach out to different departments and see what we can do. Because really leaving no stone, I mean, when you're talking to an athlete on a recruiting visit, you're saying there's no stone that's going to be left unturned to help you accomplish your goals and dreams. And so being creative and really establishing that trust and dependency on one another, I think, you know, at the lower levels, it becomes even more and more critical because there's less people at the table.
Awesome. So I wanted to pivot a little bit again, when we're thinking about the U.S. Registry of Exercise Professionals. And so organizations like CSCCA, the NSCA, ACSM, ACE, and other member organizations put their certified professionals onto the registry. A lot of the professionals don't have to do it themselves. The organizations do that on their behalf, kind of make it easier. So when we think about registration of these exercise professionals or the strength coaches, how is CSCCA sharing that with either the athletic trainer, or not the athletic trainers, the athletic directors or head strength coaches, to be able to use that as a resource as part of their hiring practice? I guess I'll ask that across the board with Dawn and Sandy, and kind of how does CSCCA communicate that to the head strength coaches, and any interactions that you have with athletic directors, and how to use that resource?
I'll take it. So what's really nice about the U.S. Registry is it is a real-time database. You know, so you can go in at any time and you can see the certificate's name, what different certifications they have. You can see their expiration dates. And so that provides, you know, an instant verification of credentialing. And that is something that we have communicated out to our membership and encouraging them to utilize that when they're looking for credential verification. So it has been very helpful for us. And, you know, it's nice for certified members to go on and see that all of their stuff is, you know, all of their information is represented and that they're, you know, one of few, right? In this, that is a credentialed, certified strength and conditioning coach. So it's, yeah, so we kind of use that side of it as well to get people excited about it.
Awesome.
I would just add, you know, just as part of that hiring process, you know, with athletic directors and those hiring committees, you know, knowing that you have a resource to help filter and make sure that you're making the right decision, I think is really important.
And we probably ought to mention, Francis, that, you know, I mean, the NCAA has now supported the idea of, you know, when you're hiring a strength and conditioning coach, you know, they need to be coming from an accredited NCCA certification program
Right.
now, which now really limits where you're getting from, which is, you know, basically NCSF, CSCCA, NSCA. And that's that registry is, I mean, the access to know for sure if that person is in good standing with that accreditation. So
Yeah, absolutely. And the registration, and thanks for bringing that up. It's a combination of the education, certification experience that you have in order to be that safe and effective exercise professional. And really, I want to underscore professional. Like this, you go to this as not just because it's a hobby, but this is really being able to show that these exercise professionals are uniquely qualified in this space. You went to school to learn how to do it. And again, it goes back to that whole building of trust, right? So I learned how to do it. I'm applying it at a very high level. I'm continuing to grow as a professional, and I have to maintain my certification in order to continue to practice. That's what the licensed health professionals are already doing. As a registration does the same sort of thing of being able to go, I can identify where these professionals are, where they're working. And that's really the kind of the stick when we're talking about the profession. It's just like, if you're not keeping up with the credential, you're no longer able to practice. And that's the one big thing, is just like, as we're kind of continuing to grow our profession, that's where it becomes really important. And I guess the last one, and again, I encourage you all as attendees to be able to ask your questions, any burning questions you have to our panelists. I want to hear your thoughts about the strength and conditioning professions at high schools. We talked about the NCAA and the Division I, Division II, and Division III programs. Sometimes you have larger budgets and you have more limited budgets. And I want to ask the question to Brent first, and then kind of open it up to you all. When we're thinking about these kind of high, these cases of athlete deaths because of conditioning related deaths, when we think about high school, what is the death? We've seen the number of deaths that have happened in high schools in comparison to universities, and kind of what are we doing about it? And so I want to ask that to Brent first, and kind of what your thoughts are in terms of just like the death rate and kind of high school athletics.
yeah, unfortunately, I think this is a much slower to get to policy area than collegiate deaths. You know, collegiate deaths get announced a lot more, and I don't think a lot of people are aware that high school death rate is 40 times that of, you know, accidental collegiate or catastrophic deaths in college athletes. It is way up there. One of my, you know, teaching also some, you know, athletic trainers going out. Athletic training does not get the support that it should be getting, you know, in terms of both pay scale as well as their importance in the marketplace, of which especially is at the high school level. Then you talk about getting, you know, both strength and conditioning coaches on the collegiate level and athletic trainers both feel amazingly stressed with the number of athletes that they have and the workload that they have. the different roles that they have. But you get out into the high school setting, you don't have any regulation over who is doing strength and conditioning. In fact, it's just the coach, or it could be the janitor, or it could be any Tom, Dick, or Harry, a parent who really wants to help coach. But you do have to have usually an athletic trainer around for helping. But you talk to those athletic trainers, of which I'm pretty good friends with some local ones around here, and they just meet their end. I mean, within a year or two, they are gone because of the burnout and the stress of trying to attend every stinking event and yet get paid so poorly. So
Absolutely. Sandy and Don, what are your thoughts?
Yeah, I would add to what Brent's saying is just the lack of any kind of regulation or standards and inconsistency in hiring practice across the country. Some high schools do a great job, the strength and conditioning side, and will go out and seek a certified coach through an accredited organization. But yet there's others that don't. It really, like Brent said, it's anybody that'll step forward. They'll put the tag on them as a strength and conditioning coach. So that's something that could really help in potentially reducing the death rate, is if high school level really got serious about requiring an accredited certification for anyone working as a strength and conditioning professional.
Don, what are your thoughts?
But just, we've mentioned the word competency several times, and what we see consistently, whatever level of college we're talking about, that out of the many different components that could be at a higher level with big budgets, the two components that seem to be consistent at every level at the collegiate level is sports medicine and sports performance. And to have that competency level then be at the high school, to Brent's statistic, I think would go a long way in reducing that. And regardless of what level you're at, the thing that can't ever get lost is, the athletes standing at the center saying, all I'm trying to do is accomplish my goals and dreams. And there be an expectation that everybody's centered around that and removing any hindrances or roadblocks in order for that to be accomplished. And so having certified strength and conditioning coaches at every level, I think would definitely go a long way to helping that.
Tim, what advice would you give?
This one's tough because, in my opinion, at some point this has to become unacceptable. And I know we all believe this, so we're talking to ourselves here, but this has to get to the right people at the right time. And, it's July 19th, and in 3 weeks that another one of these is going to happen. And there's going to be football two-a-days at high schools all across the country, and there will be a death. And what is it, 65% of schools have an athletic trainer? I don't know what the number is for strength coaches, but it's not nearly that high. And so there's not going to be the right people at the right time in the right place. And so at some point it has to become unacceptable. And I don't know how we get there, because I feel like we talk about it. It's in the news, it's in the newspaper, but things are not changing. And so it's really, really difficult to think about. But we have to get those people out in the schools, and as Brent said, not stretch them so thin. So if I'm the only athletic trainer at a high school with year-round 3,000 total athletes, I'm just weighing risk 24 hours a day, trying to find what's the most riskiest event that's happening right now, and I'll go cover that. So there's all these other things happening that I'm not visually seeing. So there might be conditioning at football on August 3rd that I didn't get to be at because there was something else happening or whatever. But at some point we have to make some changes.
No, that's awesome. And for CREP and USREPS, I think that's when we saw that death rate. And I know Brent, you and I kind of talked about that on the last time, our last board call. Like, this is a call to action to our board to really start investigating. I mean, even asking parents, do you know what the requirements are? Because I think for me, it's like I have a young child that's starting to get in athletics when she's in middle school, and I'm thinking about it's like, oh gosh, when she goes to high school, is she going to be adequately supported as she continues to pursue athletics? And I think there's a lot of assumptions, I think, from parents, just like, okay, well, your teacher's licensed, they've gone through training, they've gone to school to do that. I don't think a lot of parents really understand that when they're in those athletic departments or when they're working in athletics in high school, do you know what kind of credentials that somebody's supposed to have? And if I knew that somebody was coming in and their strength coach was the janitor, with little to no experience in developing these conditioning programs, I don't know if I would be comfortable with that. And I don't know if parents actually know that. So that's one of the charges that our board has come down to, is just like, look, we need to really investigate this and provide that as some of the results back over to our member organizations and kind of what we can do next. Great question came in through the Q&A. And again, I encourage all of you as attendees to ask these kind of tough questions to our panelists. One of the questions came in is about the collaboration between the strength and conditioning organizations, NSCA, CSCCA, and NCSF. When we're thinking about programmatic accreditation, there's multiple ways of accreditation. CASCI is one, CYES is another. And as these universities are preparing their students for jobs, they're making decisions like, okay, which way do we go from programmatic accreditation? What are your thoughts in doing opportunities for cross collaboration between organizations, and especially in particular for education? So is there opportunities for collaboration in recognizing accreditation from both of those, CASCI and CYES? And kind of want to ask that to Dawn and Sandy, what your thoughts are there.
Sandy, I'll let you go ahead.
Sure. Yeah. So, I mentioned the co-AES earlier. In looking at the knowledge and skills that they have developed, we feel as an organization they adequately prepare the student for the profession. In addition, with our certification and the 640-hour practicum that we require, we really feel that does help set the student up for success and being job ready to enter the field. But as far as collaboration goes, there's absolutely been discussions with the other organizations about how can we collaborate and show unity moving forward in this process. Excuse me. So I will assure people that yes, there are being high-level conversations about that. I don't know if Dawn wants to add anything to that.
I'll just say that, in talking to the board in terms of expanding and opening the CSCCA in terms of certification, there's definitely been discussions on that. The one thing that as an organization, because of our certification process and everything that people go through, as we've had obviously college strength coaches transition to high school and then transition back with a lot of success. Our goal is to prepare strength and conditioning coaches to positively affect the organizations that they serve, and that be wherever. And so we are definitely in discussions with that.
I think the big thing, to the person who asked that, when we think about accreditation, a third-party accreditation, I think one of the key things is understanding who the recipient is on the one who's affected by the accreditation. So when we think about university accreditations or regional accreditations, like when the student comes in, they can change their idea of a major 30 times, and can that institution support them regardless of major they select? Within the programmatic accreditation, is just like, how do you know that department prepared you to do that specific job, right? When we think about accreditation from a certification perspective, there are competitive accreditations, right? So they have ISO 17024, which is like international accreditation of credentials. That's one example of one, in which how do you know that organization who offers a national board exam is develop their exams the right way? And how do you know it's done consistently between years and then also between countries? That's the ISO standard. NCCA standard is similar. Now, within the accreditation model, which is can that association provide reasonable assurances to the public that they're certifying people who are safe and effective, regardless of profession, right? It could be a crane operator, it could be a strength conditioning coach, it could be a clinical exercise physiologist, right? There are ways to bridge it between both, as long as the standards are really darn similar. And how do you know that organization, do they have the financial funding to be able to do that? Do they have the right staff to be able to do that? Do they keep their candidate stuff safe? there are opportunities to be able to bridge between the two. And I know being on the board for the COAS, that is something that we are more than open to doing that with organizations that have substantially similar accreditations that are available in preparing students for the workforce. And so as a board member for this COAS, we are certainly open to doing that, and we welcome that. And ultimately, our job at the COAS, and kind of transitioning hats on, is to support programs that are preparing students. Don't care what organization you're affiliated with, but it's just like, does that university exercise science program prepare that student for the job in the exercise science, for the exercise science profession? Clinical exercise physiology, strength conditioning, personal training, etc. Can that university support that student? And that's where, from COAS, I think certainly we are more than open to doing that, and especially in particular for the strength conditioning field.
And I wonder, Francis, if the question that was asked here, this person is a program director. I wonder if he sees something kind of like I see from an education standpoint.
Sure.
Going through as an exercise science program. Once we heard there is an accreditation for exercise sciences, we actually now go, oh, we want to look into that. But that's from just our education model. I think he might be asking a little bit more about, not just the accreditation, but I think the fact that like NSCA kind of creates their own program, their PRP model of basically say, well, if you follow this, then you get right into the CSCS thing, and then CSCCA. Well, yeah, you might be coming through a COAS accredited education background. To me, that's a little bit different. I think he's trying to ask, is there a way to find common ground between these requirements? And, at a certification level, I don't know that there should be a true common ground. Because I think you can actually, certain certifications mean something. And I'll just give an example. Back when I was personal training in physical therapy school, and I looked at certifications, I'm going, well, ACSM certification, based on what it's requiring, that's tougher, harder. And to me, that stood out a lot more than some other personal training certifications. And in the same way, I think certifications, once they meet a certain level, at just a certification level, some certifications can stand out, in requirements. Now, this gets to a bigger question, though. The NCAA would love to see strength and conditioning go towards licensure, which would really standardize across the board requirements for strength and conditioning. And at this point, that's a long road, and that's a tough road. But that is where the medical model would kind of like to see it go.
So I think there's two comments. I think one is from an education perspective. I think when you think about it, there's like 70% overlap between 70, I would guess 70 to 80% overlap between the exercise sciences and the related disciplines. Like anatomy is anatomy, physiology is physiology, program design is essentially program design. The difference is how do you apply it to the needs of the client or the patient? Right. So how do you design it for a person who's in athletics that is doing things versus somebody who's in cardiac rehab? You're applying it. You still have the same tools. You're just applying it differently. So from an educational perspective, I think there's opportunities to go look. There's substantial overlap in what these kids are learning and the practicals they're going through. There's substantial overlap in the preparation and how you determine competency. You have different ways you can do it. CSCCA does things differently, and NSCA doesn't really matter. It's just like there's different ways you can do that. And it's really the articulation between the prep in preparing for the job and then the actual assessing of competency in the other part. The licensure piece is interesting because when you look at it from even the Obama administration or the Trump administration or Biden administration, regardless of party, there's been like kind of like a movement against licensure in the backdrop of military spouses, in which you have those folks who are certified as a strength coach. When their family member has to move to a different state, there's not reciprocity between states, and so you have to start over again. So licensure in that backdrop, there's been a lot of measures to go look. certification and registration is the way we're going, because it gives a lot more flexibility in terms of being able to identify who's safe and effective. And a national board exam allows flexibility of those folks, whether in the military or their spouses who support those military members. So I can see that there's opportunities for a greater restriction in professionalism in the industry. I think licensure is a tough slog moving forward. So we're at the top of the hour, 3 o'clock. Unfortunately, we ran out of time. But for all those who attended, we recorded it. We're going to send it out to all attendees for CSCCA and ICSM and USREPS. We'll have the recording for you all, and you can share that out. And Tim, Sandy, and Brent has just been absolutely invaluable. Thank you for your candid responses, and look forward to continuing to work with you all as we push forward to get our registered professionals identified as part of the healthcare continuum. Thank you so much. I appreciate it.
Thank you.
Thank you, Francis.
Thank you all. Great job.